This is a 24 years female presenting post cesarean, 1 month post cesarean section. History of constant pain in the suprapubic region. Now, this is a magnified view of the uterus. Here we see the cervix. This is the cervix, vagina, the urinary bladder in longitudinal section. Here you see the body of the. This is the body of the uterus up to here. Now this is the body of the uterus, and this is the urinary bladder, this black area in longitudinal section. This thin line in the center of the uterus is the endometrial canal. Thus the endometrial canal is clear with no RPOCs and no evidence of clot within it. Now, if you see that when you explore the anterior wall of the uterus, and from the region, from the lower, this is the fundus of the uterus, this is the anterior wall, and this is the anterior wall, this is the anterior myometrium, this is the posterior myometrium in longitudinal section. Now you see a breach. You don't see a wall in this region. The wall should appear bright and regular as you are seeing here. Now there is no wall seen in this region. Rather, we see an approximately measuring 4.0 into 1.8 centimeter collection. This is all collection. Only 17.7 millimeter deep from the skin. Now this collection, this area is only 17.7 centimeter deep from the skin, and is in, we can see that from the anterior segment of the mid-anterior segment, wall breach. It's extending, the collection is extending into the subcutaneous region, and this is the subcutaneous tissue, and then it makes a track into the subcutaneous tissue, and it's only 17.7 millimeter deep, and the measurement, approximate measurement is 40 into 18 millimeters. So this is a collection which can be pus or bleed because of a breach of the anterior wall of the mid-anterior wall of the uterus post cesarean section. Myometrium is okay, and you can see a lot of shadowing echogenicities within this collection. Now this is the collection, and these are the shiny echogenicities giving posterior shadow. None all give posterior shadow, but posterior shadow is evident. And this is so this is a case of subcutaneous collection post due to a breach in the anterior wall of the uterus post cesarean section that is only 18 millimeters deep from the skin, making a track into the subcutaneous tissue with multiple echogenicities seen within it. This is the transverse section, and we can again see the collection and the extension of the collection from the anterior segment of the uterus into the subcutaneous tissue with internal echogenicities. Now this is the longitudinal section of the uterus. This is the longitudinal section of the uterus. This is the central clear endometrial canal. This is the anterior wall, and this is the breech. You don't see the wall in this region, and rather we see mixed echo collection extending into the subcutaneous tissue only 18 millimeters deep from the skin in the suprapubic region. In the transverse section, this is the uterus, this area, and here you see that this is the collection. And again you see that it is extending from the anterior surface of the uterus and extends into the subcutaneous, penetrates, makes a track into the subcutaneous tissue, and this measures approximately 6 by 2.5 centimeters, and this is the echogenicity is within it. You see, this is the echogenicity within this collection, and this is most probably the bleed. This is most probably a bleed. This area. And it's, you see, in the subcutaneous tissue, uterus is here. This is the uterus in transverse section. And this is the uterus in transverse section. This is the collection. And this is the subcutaneous tissue, and this is the skin. And this collection is only 17 to 18 millimeter deep from the skin. It extends from the anterior surface of the uterus into the subcutaneous tissue. This is the longitudinal section of the uterus, and there is a breach in the anterior wall, in the mid-anterior wall, from where a collection is seen extending into the subcutaneous tissue, which is only 17 to 18 millimeter deep from the skin. Thank you.